Okay, Patricia, I'm going to hand it over to you.
Good evening, everyone. We are so happy that you can join us today. My name is Patricia. I am the chairman of Target 2 Women's Health and Wellness for Alpha Kappa Alpha Sorority Incorporated, Eta Upsilon Omega. And I'm so excited to have you all here today. We have a dynamic program for you today. So I am going to hand it over to our chapter president, Ms. Kimberly Horn, and we will get started.
Good evening, ladies and gentlemen. On behalf of the ladies of Eta Upsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated, we welcome you here today. We're in partnership this year with the Great Lakes Bay, and we are excited about what we're going to learn this evening. My name is Kimberly Horn, and I am president of our local chapter. And so this impactful event is sponsored by our Target 2 Women's Health and Wellness Committee, chaired by Patricia Vaughn. And so during our webinar on this evening, we will hear the personal journeys of breast cancer survivors. We will have a mammography demonstration, hear from an oncology specialist, as well as see a breast cancer model demonstration. So this will be an informative event, and we trust that you will learn a lot. And thank you for joining us on this evening. Welcome.
Thank you, Kimberly, for that. I am just going to go over, I'm sorry, Jill, you're up next to go over the overview for Great Lakes Bay. And I will stop sharing my screen.
You know what, if you wanted to, did you want to do anything with any of the Zoom features? You could do that.
Absolutely. So you all, although you can see us, we are not able to see your beautiful faces right now as we are in a webinar feature for Zoom. So at the bottom, there are a few options for you, just so you all know how to work the webinar. There's a chat room. So if you have any questions, any concerns, please place them in there. And we have placed 2 parts within the program where we will be able to answer questions, and Stacy will be monitoring that throughout the program. And if there's anything that we don't answer for the sake of time, at the end, we may be able to email out those answers for you. There will also be a survey that will be posted in the chat for everyone to complete, and it also will be sent out via your emails after the program has concluded. Don't forget that your swag bags are also able to be picked up at Great Lakes Bay, 501 Lapeer. Is that the correct address?
Yes, that's right.
Okay.
Yes.
501 Lapeer, we put those together for you with love. So please go pick those up. Monday through Friday. Jill, what times are they able to go pick them up?
The best time is between 9 and 11. If that's difficult, you can give us after the lunch hour. I would say between 1 and 3. Give you a couple windows there.
Okay, wonderful. Well, Jill, I will hand it back over to you.
Okay, thank you so much. Yes. So I think if you stop sharing, maybe I'll just take over. Yeah, very good. Okay, great. So let me just pop up here and okay. Thank you, everyone. Yes, so I'm Jill Armentrout. I'm with Great Lakes Bay Health Centers, and we also have a couple other panelists on here. So we have Omar and Lisa and Danielle, and they all work with Great Lakes Bay Health Centers as well. And you're going to hear a little bit more from them as we go forward. So yeah, we just wanted to give you some overview. We're really excited to be a partner with Alpha Kappa Alpha Sorority. We're really honored that they asked us to be part of this. And so if you don't know as much about Great Lakes Bay Health Centers, we previously were called Health Delivery Incorporated. If you go back, we've been around for over 50 years now. And just to give you a big picture of our organization, this is all of our locations, and the teal is our footprint. So we are a federally qualified health center. We're your community health center. We are patient-centered medical homes. These are all of our locations. There are many different types. We have primary medical centers like Jane Street. I'm going to show you another slide about that, but we are in the schools. We have mobile units. We are integrated into behavioral health centers. And we've continued to grow. So now we do have 33 locations. You can see clustered quite a bit around Saginaw County, but we're up in the Thumb, we're down in Owasso, and we go where we are needed. And we are available to take care of anyone seeking our services, regardless of your insurance coverage. So if you do not have insurance, or you have private insurance or Medicaid or Medicare, our doors are open to you. And our primary services, as you can see, they're varied. Medical care is of course right there at the top. In addition to that, we do provide dental services, and we also now have expanded a lot into behavioral health services, including substance use disorder treatment at some of our sites as well. You can see we have obstetric gynecology services. We have several pharmacies now. We have eye care, and you're going to hear more about our mammography services a little more in depth, of course, today as well. Our website is definitely a good resource for all of this information, GreatLakesBayHealthCenters.org. So as you can see, we are going to tell you quite a bit more. Our mammography is at Jane Street Health Center, and that is a phone number there. We'll put that one back up again as we hear some more from our staff. And we are going to hear more about community health workers and how we can help you with insurance. Omar is our community health worker with us tonight. He's going to talk some more about that. And then we'll share that phone number again as well. And then a little bit more, if you, we do have patients that do not have insurance, about 20 to 25%. And so we do have a sliding fee scale for those patients that meet those income requirements. And this is just a little bit bigger look at Jane Street. This was our first center in Saginaw, and it's still one of our biggest centers with the most providers. We do have transportation services as well, and this is again where our mammography service. This is right here, right off of downtown Saginaw. Okay, I'm going to go back here, and actually, I think what we wanted to do right now is go ahead and do one of our first polling questions. So I'm gonna stop sharing so you can see all of us again, and we have 3 polling questions for you tonight to learn a little bit more about you. And let's just go ahead and do this. This is an easy question, but it's an important one. I'm going to launch it right now. Have you had a mammogram this year? And please go ahead and answer, and we'll give that give you all a little bit of time. So we've got 34 participants right now, so we'll see. We'll try to get everybody in there. All right, we're about 80%. Almost done. Everybody's almost done answering. Looks like this is working pretty well. Couple more people. We'll just give it a couple more seconds here. Right now, what we're looking at is about 70% have. Can you see the polls, everybody? Okay, so I'm seeing about 70% is a no for this year, and 30% is a yes. I'm gonna go ahead and end the poll. We got almost everybody, short of just a couple people. Okay. I'm going to share the results then. Here we go. All right. I think now we can see those results, correct? Yeah. So we do have people that do need to get their mammogram. Maybe they're scheduled for later this year, but we certainly are going to have a message for you. If if you have not gotten scheduled, then we can talk more about how to do that. Okay. So I'm going to go ahead and close that out. And then I think what we wanted to do now is go to one of our first survivor stories that we have. And just going to go back into the, let's go right ahead here and see. I think we wanted to go ahead to our third. Yeah, okay. I'm going to share my screen again. Okay, and this is going to be one of the sorority members, Jeanette. and she's going to share her story.
Hello, my name is Jeanette Brown, and I am a member of Eta Upsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated. I was initially diagnosed with breast cancer in the year 2015, and it was my very first mammogram. I was diagnosed with ductal carcinoma, and I would encourage anyone who is reluctant about getting a mammogram or doing self-checks that really it shouldn't even be a thought, because it could definitely save your life. It was my very first mammogram that I was diagnosed, and I would have never even caught the cancer by doing self-checks. So self-checks are important, but mammograms are more important, actually. So I would do both, do your self-checks and go get your mammogram. Because I was diagnosed early with my very first mammogram, I was stage 0. Like I said, I would have never found it by doing self-checks. I opted to have a double mastectomy because it runs in my family. I don't regret my decision at all. It is so important for you to get your mammograms, to do your self-checks, and to go see your doctor regularly. I don't regret it. I always look at the positive in everything. The positive for me now is I don't have to wear bras. I had reconstructive surgery, so I don't wear bras, and I'm happy about that. I would just say it could save your life, the mammogram and doing your self-checks. Early detection is definitely key.
Yeah, that's a great message. I'd like to say thank you to her. She's not here with us, but it felt like she was. So yeah, that was great. That was great. Thanks for sharing that video with us. And I was just going to note a quick note in the chat was some of our participants said that they picked no because they are not the age that's recommended according to their physician. So that makes sense. We definitely would have different age people here, correct? And I know we'll hear more from Roxanne is our nurse here, and we have Lisa as well with mammography, so we can talk a little bit more about those recommendations for that. But that's a very good point. Thank you for noting that. We are just going to go right ahead now and just show off a little bit more of if you are younger and you haven't had your mammogram yet, but you're thinking about it, it's down the road. Maybe you're nervous about it when you do get to be the age of, I think overall, correct me, Roxanne, 40. Is that the most recommendation? Are there some different variations and recommendations for your first mammogram? Roxanne or Lisa, can you help me verify that?
Okay, what was the question again, Jill?
What's the recommendation for a first mammogram? Is it really varied?
It does vary, but I believe that what they do now is that usually women who are like 50 to 74 and are at average risk for breast cancer, they're recommending mammograms every couple of years. But women who are like 40 to 49, they should talk to their doctor or health professionals to find out if they need to start earlier. But again, this all really depends upon what your history is.
Mm-hmm. Okay, that's helpful. And Roxanne is an oncology nurse with Ascension Healthcare. So we are going to definitely hear more from her. But thank you. I didn't want to skip over that question a little bit here. So let me go right ahead here. I'm going to go back to. We're just going to go through 2 quick things here. Okay, so I do have our video here, and this is going to showcase what it's like to get a mammogram, and this is actually you're going to see this at our Great Lakes Bay Health Jane Street location.
Come on in. I'm Kim. I'm going to do your mammogram today.
Hi, Kim. I'm a little nervous about this. This is my first mammogram. Do you mind showing me how it works?
Oh, sure. Thanks to our donors, we have a new 3D mammography. Come on over. Let me show you how it works. We're going to do 2 separate views. The first is a front view. You come to the front. Your breast will go up here on the plate. This top part will come down. It'll press down on your breast at the end of the exposure. It'll lift up, and then it will turn into the side view and take a side picture of your breast. When the 3D portion is in motion, this part up here will be moving and stopping all by itself. That's what takes the 3D part of the pictures.
Okay. So why do I need a mammogram? Why can't I just get an ultrasound?
Well, mammography is the only good way to take a picture of the entire breast. If you have an ultrasound, it looks at a very small area of the breast at a time. Also, mammography looks at all the abnormalities in the breast, whereas ultrasound is not designed to look at all of the abnormalities. If you have an abnormality in the mammogram, we may use ultrasound to determine what that single abnormality may be. And mammography also is very good for implants, looking at the structure, the health, and the abnormalities of those as well.
Will I be exposed to a lot of radiation?
Well, actually, it doesn't use that much different radiation than a regular 2D mammography.
Okay. And how often should I get a mammogram?
Well, the American Cancer Society recommends an annual mammogram for women over the age of 40 and for men who are having a breast problem.
Will I get my results right away?
Well, I'm a mammographer, not a radiologist. Your radiologist will read your mammogram and send a report to your family physician. You will get a much more simplified report at home in the mail.
All right, Kim.
Do you have any more questions?
No, I think I'm all set now. I feel much better about getting a mammogram.
All righty. Well, go ahead, get dressed.
Great, there we go. Website as well. Okay. All right, well, we're going to go back to our group here. And we are actually going to hear a little bit more from Lisa, who you saw in the video. She was acting as a patient, but she does work for Great Lakes Bay Health Centers. And she's going to just tell you a little bit more about her job and how she helps women, how she helps women, and how Great Lakes Bay Health Centers really tries to help women have access to mammogram.
Thank you, Jill. Hi, I am Lisa Urbina. I'm the mammographer clinical assistant here at the Great Lakes Bay Health Center, Jane Street Clinic. Kimberly Eves is our mammographer tech. She was unable to join us this evening. Just to give you a little background about myself, I've been with Great Lakes Bay Health Center going on 17 years now. In November, it'll be 17 years. I started off as a medical assistant at the David R. Gomez Center and then transferred into radiology in 2014. Me and Kim work very close with each other. I don't take the pictures. Kim is actually the tech, so she would be taking the images. I do most of the backgrounds in mammography. I will be the person you contact to schedule appointments. I will get those results from the radiologist, do any callbacks, follow-ups, schedule any ultrasounds, biopsies if needed. Our mammographer, our radiology group is, it's a new group with Great Lakes Bay Health Center. Their name is VRAD, Virtual Radiologic. Our lead radiologist name is Dr. Arlene Sussman. So that's just a little bit about mammography at Great Lakes Bay Health Center.
Thank you, Lisa. That is a phone number there as well for work with your primary care doctor to make an appointment for a mammogram. Is that right?
Yes, yep, that is the correct number for you to call to schedule appointments with our at our mammography center at the Jane Street Clinic. You will need an order from your Great Lakes Bay Health Center physician in order to schedule.
So our mammography service is for people who do have a primary care doctor with the organization.
Yes, correct.
But we do have some slides at the end that go over all the
mammography locations within our surrounding area. So I believe we have Saginaw and Bay County listed on there for all the participants as well.
Of course, yes, because there are definitely other places that you can get a mammogram, of course. And just let's see. I think too. Now we were just going to see if there were other questions. I know Stacy, you've been kind of helping us with look at the chat. Is there anything there that you wanted to mention, or any questions, or if people do have some more questions right now, this would be a good time to put them into the chat.
Okay, I do have some questions and some comments. The first comment, I noticed that some people said they didn't get their mammogram yet because they weren't old enough. So that's why they answered no. So that may be why some of the numbers were low. And a few people said they have their schedule. The question is, I had the 3D in September and was told I had dense breast. Does the density make it more difficult to find the tumor? And there's another part to this question. Is there anything you can do other than self-check to help?
Thank you, Steve.
I wish we had a radiologist here to talk about this, and the mammography tech might be able to comment on this also. But yes, dense breasts can make it more difficult. And oftentimes the physicians will also order an MRI scan. We've come a long way in terms of identifying and looking at dense breasts, because a number of years ago, we only had just mammography, and now they have special type of mammography machines, and they have MRI scans that they can utilize to better assess dense breasts. And the dense breasts are actually, there's a grading system that the radiologist uses for that.
Thank you so much, Roxanne. Yeah, that's a great question and a good answer. That's helpful. Yeah, and and anyone else, if you have other thoughts, Lisa, if you had anything else to add, but it seems like that was a good answer for that question. I think right now, let's see, Stacy, I think that we had, she says thank you. So I know some people were commenting on the fact that, yep, they've gotten theirs, they're scheduled. That's great. I think are we caught up on questions for right now?
I have one more.
Oh, please, yeah.
Question is, I have my very first one in July. I was very, very nervous, but it was not bad. And I thought it would be. And I guess that's a comment. I'm sorry, it's not a question.
That's okay. That's good to hear.
Okay.
And some people do have family history they were mentioning, right? So people are getting it every year. Yeah, no, that's good.
Okay, that's all the questions so far.
Thank you. Yep, and please do feel free to continue to put those in the chat, and we'll go back to those again. Absolutely. And I think what we're going to do now is do another video. So I'm just going to get us to our next video because I know we have another one to share with you. Okay. Yep. So I'm going to share my screen. And we also, this is Kimberly, who we have with us, and we're going to share her video.
Hello, I'm Kimberly Horn, a two-time breast cancer survivor. I was diagnosed in 2013 and had a lumpectomy and radiation. My mother was also diagnosed with it the same year, but praise God, he brought us both out. I was diagnosed again in 2017 and had another lumpectomy, chemotherapy, and radiation. My hair came completely out, but praise God, it's in the process of growing back. We were devastated when my sister Bridget passed away from this disease at the age of 32. My grandmother also passed away from it before I was born. I'm thankful for my family, my friends, the Nations Church, my sorors of Alpha Kappa Alpha sorority, who are a support to me during this time. I'm especially grateful to my parents who came to live with me during chemotherapy to be a support. I strongly encourage all women to have your mammograms and do monthly self-examinations. Early detection is key. I'm grateful to God for my life and good health. God is a healer, a deliverer, and a sustainer of life. I am truly blessed.
Thank you so much for that. Yeah, that was great. Thank you, Kimberly. Did you have anything else to add? I know that was a great message.
Just want to reiterate, like it's already been stated, get your mammograms and don't blow that off.
Yep, don't be afraid. A lot of support here for that. Thank you so much. So we're going to go back, and we've already heard some really good information from Roxanne, but I'd love to give her the floor now for some more detail about her work and more information about breast cancer.
Okay, thank you, Kim. I am an ICU nurse. I have also had experience working in oncology. I also had some experience working as a nurse navigator with some breast cancer patients. Right now, I have been also working and learning how to assist with biopsies at St. Mary's Ambulatory Care Centers, the Town Surgery Center out on Schust and Town Center Road. And then I also work as a pre-procedure test nurse. So sometimes I have to call patients who have been diagnosed with breast cancer and get their histories and tell them what to expect for surgery. And I really want to share with you the importance of mammograms and how it actually literally did save my life. And I want to take you back a little bit here on this journey, because I want to tell you, when I was 45 years old, I had a baseline mammogram, which was the routine at that time. 45, get a baseline. Then when I turned 50, my primary care physician said, okay, let's start these on a regular basis. And I said, okay, right, that's cool. Well, I was busy. I figured I'm healthy, I'm fit, I have no family history, I do self-breast exam every month. Why should I bother? I was too busy. When I turned 51, I went in for my yearly exam, physical, and my doc said, okay, well, I'm going to put in for another mammogram this year. Go ahead and start them. And I'm like, yep, I'm definitely going to do it. And I did, but it took me literally months until just before my 52nd birthday when I scheduled my mammogram. And I was actually going to cancel that one too. I was working full time. I was also working adjunct faculty at Saginaw Valley with nursing students, and I was also helping to take care of my elderly parents. So I was really busy. But I finally decided, I had that day off from work. I said, okay, there's no reason not to go do this. So on September 28th at 11 a.m., I went and had my mammogram. And then went about my day just like usual. And then at a little bit before 5 o'clock that evening, I got a call from my primary care physician. And that call could come from your primary care provider, who could be a physician, it could be a nurse practitioner, physician assistant, and in some cases, it's even like a nurse navigator who calls you. And there was an irregularity. I thought, okay, no big deal, really. The irregularity was called microcalcifications, and I just want you to remember what that word is, microcalcifications, because I'll explain why it was important in my case. And what happens during this time, you have your mammogram, the radiologist sees an irregularity, and in his report that goes to your primary care provider, he's going to make suggestions, recommendations in terms of what you should do. And it could be anything from a follow-up mammogram in 3 months. It could be a biopsy, which could be either stereotactic or ultrasound guided. And in some cases, they even recommend like an MRI scan. So 4 days after I had the mammogram, I had an appointment, which was set up by my primary care physician with a breast surgeon. She reviewed my mammogram and said, yep, we definitely need to do a biopsy on this. So 2 days after that, I actually went in to the radiology department again, and the radiologist did a stereotactic biopsy. And I didn't really realize until that moment in time that there was quite extensive microcalcifications, and they actually did a 3-site biopsy on the right breast. And so that was quite a few. And I have to say, at that moment in time, being a nurse, I thought, okay, this might not be so good. And then what happened is, usually about 2 to 4 days after you have that biopsy, you end up hearing back from your primary care provider in terms of what the results are. And if you don't, then you really need to call and ask. But usually you hear from them. And I fortunately heard 2 days later, and when my primary care doc called, she said it was cancer, and it was actually positive cancer in all 3 sites. So I knew, okay, well, that's not so good. And what's really going on behind the scenes at this point is that you have a pathologist who's studying the tissue. There's laboratory tests that are being done, and all of this is really being done because they're trying to look at what your tumor type is and because that guides them in deciding what's going to be the best course of treatment for you. And it's very individualized today. It is not a one size fits all. It's very individualized. And the other thing that happens now, after you've had this diagnosis, you have a lot of discussions going on and a lot of decisions to be made. And sometimes it's overwhelming, and it's a good thing if you have someone with you when you go to appointments who can also listen in and to get an understanding, and maybe you might be a little overwhelmed and forget some of the information. But you usually end up seeing at this point the surgical breast oncologist again. You will probably see a medical oncologist, and then often you will see also a radiation oncologist. And what they're doing is that they're going to meet with you and they're going to discuss options as far as what type of surgery. They're going to discuss chemotherapy, and chemotherapy today can be done either before or after surgery. It's very individualized. Radiation, they will discuss hormone blocking agents, depending again on the specific type of cancer you have. And then also reconstruction options too. My tumor happened to be, it was in the right breast, and I didn't really have a choice because mine was so extensive at the time that a lumpectomy was not recommended. It was a mastectomy on the right with a sentinel lymph node biopsy. The reason they do that sentinel lymph node biopsy is to see if those cancer cells have gotten out and traveled into the lymph system. And when that came back, I was positive for lymph node cancer. And I also had one of the lab tests that they do is called an Oncotype DX test and diagnosis to kind of guide them in terms of whether chemo would be beneficial or not. And it was going to be beneficial in my case. So while I was waiting to get chemo, I had a port put in for chemotherapy. It was put in under the skin, so I did not have to have an IV and get poked every single time I went. And then in the meantime, what happens is that, at this point you have a node positive breast cancer. So the oncologist will usually order a CT scan because they're looking to see if in the chest, abdomen, and pelvis, if it has spread anywhere beyond the lymph node. They are looking at bone scans to make sure it's not in the bone. They're also looking and doing like a scan on your heart to make sure that your heart is in healthy condition to withstand chemotherapy. I was fortunate that it had not spread, so I was a stage 2B, they called it back then. And so I was lucky because if it spreads, you're a stage 4, which is still treatable, but it's not curable. So I had the chemotherapy over a period of 4 months. I had dose dense, they call it. So I went every 2 weeks. And once I finished my chemotherapy, I had radiation, which lasted probably about a month and a half or so. And then after that, I started on hormone blocking agents because my particular type of cancer was dependent upon estrogen and progesterone to really grow. And then probably a year down the road after that, I finished my reconstruction. But I think what's really important here that I want you to know is, number one, this month right now, October, marks 10 years since I've been diagnosed. And there's been no recurrence of cancer. So I'm very, very lucky about that. And I say that because, remember I said earlier, microcalcifications. It was lucky I didn't put off having that mammogram on September 28th, because if I would have canceled that again, I may not even be sitting here to talk with you. It could have been at that point of stage 4. And like I said, that's treatable, but it's not curable at that point, okay? And the reason is because with microcalcifications, even though I was doing self-breast exam, there was nothing to feel. There was no mass, there was no lump, there was no change in the appearance of the breast. No, there was no change in the skin appearance, nothing. I would not have found that cancer had it not been for that mammogram. So it's the mammogram that actually saved my life. So really, to all the participants that are listening, I know this is Friday. My recommendation to you on Monday is call your physician, see if you can get a mammogram scheduled. Don't be afraid of it, because you know what? It's a little bit, you have a little bit of discomfort for a few seconds. That's it. Okay. It doesn't last long. And the other thing I also want to say is don't be afraid, because the majority of irregularities or abnormal findings on mammograms, they are not cancerous. Okay. But look at me. If you happen to be like me and you're that 1 in 8 where the mammogram catches your cancer early, you can catch it, you can treat it, and go on with your life.
Wow, thank you, Roxanne. We're so glad that you are here.
I am too. Thank you. And thank you for inviting me, because it's a really, really important message.
It is, and you know, and it's complex. I mean, the things that all of the treatment, you know, it does sound complex, but like you said, it's simple to start with that screening test, and
Yes, absolutely.
yeah. And I think that you know, we should let people know for sure. We've got a lot of information that we're sharing, so definitely, if you have some questions from that, put that in the chat, and we will get back to our questions here in a little bit. But since I know we still have more on the agenda, I'm gonna keep going forward. In fact, I'm actually gonna go right now and do another poll, our second of our third poll of our 3 polls. And let's go ahead and do this. So I think what I need to do is just go to the next one. Okay, very good. I think I'm going to go ahead and do this one next. Okay. All right. So we would like to hear what you feel are the main barriers for women getting a mammogram. So we've got some multiple choice here for you. Give this a few seconds. One might take a little bit more thought, and yeah, maybe we do even have. I had to pick one. I know that you might feel that there might be more than one. What's your top thought? About 73% right now of everybody answering. Give it a few more seconds here. Okay, I think we probably are done here. Let's go ahead and end this. I'm going to share it with you now. So, yeah, that fear of the diagnosis is really our number one with 50%. Fear of the discomfort, and really Roxanne definitely talked about both those things. 37% though said also the cost or having no insurance. And as I said, that, you know, certainly our organization does really work, and Omar's going to talk more about that too. There are different kinds of programs beyond us as well, and trying to, you know, making sure that doesn't keep you from getting a mammogram. And then also transportation, and we did put that on there, partly because I can say that our organization, Great Lakes Bay Health Centers, can provide transportation for you. So that is a consideration for some people. That's not the top reason though. But yeah, thanks everybody for sharing. Very good. And I see that we just had a comment here too. Sometimes I think you're talking a little bit, Monique, about conflicting information, limited provider input and outreach. So some of it is, you're talking just a little bit about how do we have our doctors and our primary care doctors talking about mammogram. Yeah, so if you have any other questions about that, you can certainly share that too. Okay, very good. And you know what we're going to do now is we're going to switch over to you, Patricia, and you can go through a couple of those other slides where we have some more facts and information for you.
Okay, wonderful. I will share my screen.
Okay.
Okay, so we're just going to go over some quick facts about breast cancer. Everyone has given, the panelists have given wonderful, wonderful information. So a lot of this information that we put on these slides, they have already went over it. So I am not going to bore you with the details or read everything verbatim. But some interesting things that I found that I was personally not aware of, and maybe some of you were, is that a lot of our facilities, the facilities who offer mammograms within the United States, have to meet standards set by the FDA. And it's a law called the Mammography Quality Standards Act. So under this act, the FDA inspects the safety and reliability of all the mammography facilities like the hospitals, the clinics, the x-ray centers. So always look for this certificate. So this is also something extra you can do if you have to schedule, your mammogram. Because it shows that the staff have completed specialized training and have the equipment that has been properly inspected, which is also key in that. And I know Great Lakes Bay has this wonderful new machine that they were telling me about. We also talked about within the video how a mammogram is a low dose x-ray picture of the breast, and a trained expert would take several pictures of that. We saw that throughout the video towards the beginning of the program, so I won't go over that too much. Our next one talks about women with disabilities and women with breast implants can also get mammograms. They are accessible mammography facilities for women with disabilities. You can go to the American Cancer Society to look for those specific facilities that can assist you, or ask your provider to assist with that as well. Excuse me. Fact 4, women should talk to their doctors to see if digital mammography is right for them. Digital mammographies are pictures of the breast that are viewed on a computer, and regular ones are viewed on an x-ray film. I'm sure Roxanne or Lisa can expound upon that. And I believe we had a chat question regarding this, regarding women with dense breasts, so breasts that have more tissue than fat. So again, you guys really touch on a lot of this. And obviously we know that mammograms can detect breast lumps when they are very small and long before they cause symptoms or problems. But we also, how Roxanne shared her powerful story, that there was nothing to feel, that she did her self-examinations every month and there was nothing there. And she still needed that mammogram to actually show her what was there. And I'm so thankful that just a few days ago was when you had that mammogram on September 28th. I'm sorry if you see my pup pop in the screen. Factors that increase risk: having your first menstrual period before age 12, never giving birth or being older when your first child is born, starting menopause after age 55, taking oral contraceptives, personal history of breast cancer, dense breasts, or some other breast problems, and a family history of breast cancer, which I think a lot of the participants have put, or some of the participants have put in the chat. So Stacey, I'll let you go ahead. I'll go to the next one so that you can take over.
Okay, thank you. So the CDC has warning signs: new lump in the breast or underarm, thickening or swelling of the part of the breast, irritation or dimpling of the breast skin, redness or flaky skin in the nipple area of the breast, pain in the breast, any change in the size or shape of the breast, and nipple discharge other than milk, breast milk, including blood. Those are the CDC warning signs. Mammography locations. Great Lakes Bay has a site at James Street. St. Mary's Ascension, they have 2 sites, Saginaw and Bay City on Euclid, and McLaren Bay Diagnostic. Covenant Healthcare has 2 sites, Mackinac and State Street.
I will stop sharing my screen, as I know Jill has another patient video for a survivor story. So 1 second.
Thank you. Yes, I do have the self-exam video. Should we do the patient first?
In the aspect of time, I mean, we have went over the self-examinations very extensively. So I think the patient videos are more important than our self-exam video here. And our last few points, I think, are more important than that as well.
Sure. And you know what? And then we can also go back to that if we do have time as well.
Absolutely.
Yes, we are just going through things here. So I am going to go through my clicked off for a quick second. So we're just going to get to the right video here, and I will go ahead and show that to you and start sharing right now. Okay,
Hello, I'm Tarshia Lewis, and I am a patient here at Great Lakes Bay Health Centers. I've been a patient here for over 25 years. I'm a member of the board. I've been on the board for over 6 years now and had the privilege of becoming the assistant secretary. I'm very comfortable here at Great Lakes Bay Health Centers. I remember when I first started coming here as a young girl, I was nervous at first, but the more I came, the more comfortable I felt, and I started noticing that it felt like home. I remember one time when I had to come in, I was used to seeing women doctors. I had to see a male doctor, so it made me nervous. When the doctor came in, he must have knew I was nervous because he started joking with me and talking to me about things. And from that point on, I had a feeling that I never had to be uncomfortable again, whether I ended up with a male or a female doctor. It got to the point to where I got old enough to have a mammogram. And I was nervous because of the pictures that I've seen in brochures and stuff. So when I got in there and I was talking to the lady or whatever, and I told her how I was feeling, she made me comfortable again. I love that. I mean, I could encourage anybody that if they did come to me and tell me that they were nervous, I would let them know, you don't have anything to be nervous about. And it's a good thing to get done because if they find something, early detection is the best detection. And I think that having the mammogram center here at Jane Street is very good for the women in the neighborhood, or, if this is the place that they go, because we do have the transportation to get you here. Just being a part of Great Lakes Bay Health Centers, I wouldn't go anywhere else. Because the doctors here at Great Lakes Bay, they make me feel like I'm a part of the decision that they make. That's what I look for if I go somewhere else. And if I don't get that, I try to make sure I stay within Great Lakes Bay Health Centers, I feel like our motto here is that we do what we do for our patients because we really do care. And as a patient on the receiving end, I feel like that's what we do here. That's what the doctors do. Anybody that I've seen, the mammogram center, whoever, I feel like they care. I don't feel like they just doing it because it's their job. I feel like they really concerned. And I remember when I had a mammogram, my first mammogram, and the lady called me back in. I was scared again. She pointed out a teeny weeny spot that she was concerned about. The image was about as big as my head. So for her to point out this spot with the tip of an ink pen, it had to be teeny weeny, but to see that she cared enough to point that out to me, she made me feel like I'm not just here by myself, so when I went and got it checked and everything, it was benign, but still just to know that something even that small, she was concerned. She could have just said, that's too little. Oh, it's nothing. But she did. She called me. She brought me in. She actually showed me. She let me see. She didn't just tell me. Everything still turned out okay, but it just gave me another sense of security to know that something that tiny meant so much to her. So it made me feel like, hey, we doing the right thing here.
Yeah, so that is Tarshia, one of our board members. So I'm glad that you got to hear from her. And I think, Patricia, I think it would be good. I'm going to stop sharing because we would like to make sure we have time to hear from Omar just a little bit more about, like we said, talking about barriers and everything. And then if we have time, we'll go back to that talk about self-exams a little more. And then we do also have Danielle who's going to speak to us. So I'm going to let Omar take over for a minute and talk about his role in the organization.
All right, good evening. I'll be brief. My name is Omar Jones. I'm a community health worker with Great Lakes Bay Health Centers at our Jane Street Center site. What we do as community health workers is we help to eliminate barriers in the lives of our patients. A lot of times it could be barriers related to food, clothing, shelter, utility support, and also health insurance, as one of our polls said. We help work with our patients to find qualified health insurance plans through the health insurance marketplace, as well as with Medicaid. And we also do referrals out for Medicare if that's necessary. What's most important for us to really just share with you tonight is that we are available. You can reach out to us if you do need health insurance assistance. If you want to talk about some of the things that may be preventing you from getting the care that you need, if you need help with understanding transportation benefits and other benefits that might come along with your health insurance, you can reach out to us. The phone number where we can be reached is 989-921-5353. Thank you.
Thank you so much, Omar. Yeah, we really do. And there is an opportunity. We'll have a survey at the end that, if you did want some more information, you can share that. You can share your contact with us and we can get back with you too. Whether you are already a patient at Great Lakes Bay or somewhere else, or you're seeking a care provider or a mammogram. And so, yeah, I think, should we go ahead, Patricia, and have Danielle speak? And then that will leave us a little cushion at the end to, go over any other questions. Again, if you did have questions right now, thank you for putting that number in the chat there too. Again, any questions about finding us a resource for mammogram, questions about what is available to you, please put that in, and then we can, at the end here, we'll make sure we wrap up with any other questions. And yeah, but I would just like to welcome Danielle now to go ahead and share her story.
Hello, everybody. I first want to thank everybody for showing your support. It's greatly appreciated. I'm going to hurry up and let's get to the story. So I first told my OB I was 17 weeks pregnant. I first noticed some changes. She right away scheduled me to have a mammogram done, which I had to do it myself because they were kind of busy there. So when I tried to schedule my mammogram, the lady told me, no, I will not schedule you a mammogram. You're 27 years old. What do you need a mammogram for? You got a lump or something? I was blown back by her comment. So she didn't schedule me a mammogram. She did do an ultrasound though, and got it so that my insurance would pay for it. My results came back from my ultrasound and they told me it was mastitis. So after like 4 rounds of different antibiotics, nothing worked. There was no changes. I begged my OB to do something different for me. So they sent me to the hospital where I got IV antibiotics. There I met a hospitalist and he said, today is your lucky day. And I said, huh? I'm like, okay. And he says, we have a breast surgeon here. She only does breast surgeries on Thursdays. I would like to ask her to come and see you in between her surgeries. To get a second opinion. I was happy, finally. This lady came in, she didn't play no games. She came in with the hospitalist and told him, please, let's take advantage of her while she's here. Let's do a second ultrasound. I would like to do a skin biopsy. So she did the skin biopsy and she turns and she looks at me and she says, and I'm going to personally call myself and schedule you your mammogram, which she did. I went in the very next day, which was a Friday, to get my mammogram. It seemed like the weekend took forever. But when Monday came along, I got a phone call from her nurse. It was a little after hours. And she asked me to come in for an appointment. Dr. Bays had an appointment tomorrow. And I will, if you can bring, sorry. If you can bring a family member. worked in the medical field for a while, so I kind of figured that wasn't a good thing. So I asked my mom and my kid's father if they can come with me, and I warned them, like, it might not be good. So the next day we get to our appointment. Dr. Bays comes in, and she comes in with her nurse, and she has a box of Kleenex with her, and she just wanted to tell me, you know, that your biopsy results came back positive for cancer. I couldn't, it was hard to hear that. It was hard to hear that. I was 24 weeks pregnant at the time, and I was like, okay, well, guess I'm gonna wait for my kid to be born because I don't want nothing to happen to him. But she reassured me. She was a great doctor. She reassured me that, you know, if I waited, that I probably wouldn't make it. As fast as the ultrasound shows that the tumor grew, and my mammogram showed that my lymph nodes were also suspicious, that I needed to start as soon as possible. And she reassured me, you know, she had other patients my age who were pregnant in my same situation, who's made it, and their kids are perfectly fine. And the next week I got my port put in, I started chemo, and I am here today. 4 years and in recovery 4 years later.
Your child is doing well, right?
My child was born with more hair than I had. So and he is doing great. He's in karate right now. So he is a wonderful, wonderful little boy.
Wonderful. And I know we're so close to the end, and we've had so many wonderful things, and I just want to make sure we give Patricia and Kimberly, but thank you, Danielle. And like you said, I mean, your big message is be an advocate for yourself and know your body. So I think that is just a really strong message. I want to take Patricia, Kimberly, please, I want to make sure that you get to have the final word.
Hello again, everyone. Danielle, that was an amazing, amazing testimony. It was very dynamic. Thank you so much for sharing. Thank you so much for reaching out to us and saying that you wanted to share your story, because I'm sure there's just so many different facets to it that I would have never thought of that at 27 and you're pregnant. I couldn't imagine how hard that was for you, but I'm glad to know that you're here, you're standing, your child is beautiful and healthy in karate. So I'm so happy to hear that. I want to say thank you to everyone for attending. Jill, myself, and my committee, the chapter, we worked so hard on this program. And at first we wanted it to be in person, but because of COVID, we weren't able to do so. So I just want to say thank you so much for attending. This is recorded, so we will be posted on Great Lakes Bay website, and it also will be posted on all of our social media platforms. So please like it, share it, send it to your friends. And again, just thank you so much. Thank you to all the panelists. Thank you, Omar, Miss Roxanne, Jeremy, for making sure all of our IT is going okay, and Lisa for being on tonight. I really appreciate it. And I hope that we can have more collaborative efforts with us at Great Lakes Bay in the future.
I echo those comments. Thank you, everyone. Thank you, Great Lakes Bay Health Centers, for collaborating with Eta Upsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated. I enjoyed all of the testimonies, their survivor stories. Thank you, Roxanne, for talking to us about what happens throughout the process. The videos were wonderful and powerful, powerful testimony, Danielle. Thank you for being persistent. It saved your life. And thank you to all of the survivors who gave their testimonies. Special thanks to Patricia Vaughn and the committee, the Target 2 committee, and the members of Alpha Kappa Alpha Sorority Incorporated. As I mentioned during the welcome, this is one of our target programs, Women's Health. And so I just am grateful. I'm overjoyed right now. And I know that somebody will be touched and informed and have their lives saved by the powerful and informative information that was given here tonight. So again, thank you. And this concludes our program.
Yes, thank you everyone so much. We are so happy to be partners, and yes, and we're going to say have a beautiful evening and have a wonderful weekend. And thank you so much. Please watch for the survey that's gonna come up here at the end for us. I think that should be coming up next.
And
So I'm
don't
good.
forget to grab your swag bags from Great Lakes Bay.
Yes, they are still there for you. Thank you.